Okay.
Madam, can you hear me now?
Yes, we can hear you now. Please
Sorry for the
continue.
inconvenience.
Please go ahead.
Once Sigmund Freud said, one day in retrospect, the years of struggle will strike you as the most beautiful. A very good afternoon to all. It is with great pleasure that we welcome the guest speaker for today, Dr. Devasmika Arya Singha, Head of the Department of Chemistry, Professor Manavadevi Ganehenege, the Senior Treasurer of our Society, Dr. Tiloka Aryasena, and all the lecturers and persons present here today. During this difficult time where most of us are confined to our homes, it is very important to nourish our mind, focus on positivity, and inculcate good attitudes within our hearts. Thereby, the Chemical Society of University of Peradeniya decided to present the guest lecture 5 of the year 2021 based on the topic, Keeping Mental Well-being a Lifetime Approach. Now, I cordially invite our guiding personality, the Senior Treasurer of our Society, Dr. Tiloka Aryasena, to introduce the guest speaker for today.
Okay, thank you, Rohini. Today, it's my pleasure to introduce Dr. Devasmika Arya Singha, the head and a senior lecturer from Faculty of Medicine, University of Peradeniya. She is also an honorary specialist in psychiatry at Teaching Hospital, Peradeniya. Dr. Devasmika graduated with the MBBS degree from University of Peradeniya in 2001. She obtained the MD degree in psychiatry from Postgraduate Institute of Medicine, University of Colombo in 2008. She underwent specialized training in Young Hospital, New South Wales, Australia in 2010. She became a board-certified consultant psychiatrist in the year 2011. She was recently awarded 2 scholarships, namely Women Ratnan Scholarship and Full-Time Higher Degree Research Scholarship by Australian National University. Dr. Devasmika has a number of journal publications, and her book, Obba Saha Obage Manasika Saukya, has gone to the second print within 3 months and being translated to English and Tamil. With that, I would like to invite Dr. Devasmika to deliver the lecture, and she's happy to address any questions or concerns that you have after the lecture. Over to you, Dr. Devasmika.
Yeah, thank you very much, Dr. Aryasena, for that kind introduction and also for inviting me to deliver this lecture. This is a kind of a vast area. I'll try my best to finish it within an hour. Yeah, we'll start. First, I thought of introducing the word health. According to the WHO, it is a state of complete physical and social well-being. And I have highlighted here, it is not merely the absence of disease or infirmity. This is very important because we may not have any illness, either physical or mental, but still we may not be having the health that we wish to have. Mental health and physical health, they are like the two sides of the same coin, and obviously inseparable. This is like human brain, you all know. I just wanted to show the gross anatomy of it. Yeah. Can everyone see the full slide? I'm just trying to move the...
We can see, Dr. Devasmika.
Okay, that's good, thanks. Since mind is a product of our brain, I thought of mention a little about how our brain develops. Our brain starts to develop very early in the gestation, by about 10 weeks, you can see something similar to brain has already appeared. So at the 40 weeks, when the baby, the fetus is ready to come out, then you can see how the brain is. Sometimes contrary to the common belief or common knowledge, that brain growth stops after maybe 2-3 years of birth, it's not the case. Our human brain, it develops until about 22 to 24 years. It's not mainly about the size that we are talking about, but the maturity. Since you all know about the white matter and gray matter and all, it's mainly about establishing neuronal connections, and then sometimes some nerves are being pruned out. So this is the maturity, and this maturity doesn't happen haphazardly. It is very well guided according to the experiences one received from the very early childhood. If someone doesn't get good experiences, then that person's brain will not grow to his or her full potential. And it's not only about the potential as far as academic or other achievements are concerned. It's also about disciplined adult, disciplined citizen. All these things also are important when we talk about the development of the brain. We'll see what are the factors affecting the development of our brain. You can see infections. Mainly, I wanted to emphasize on the infections for the brain like meningitis or encephalitis, but infections in other organs like maybe a pneumonia, which affects the oxygen transmission of the to the brain. That also can affect the brain development adversely, and of course the genes. Then nutrition is very important before and after the birth. So now at the most of the time, I think people are not ready for the pregnancy. By the time they know that the woman, the female knows that she is pregnant, maybe 6-8 weeks, or maybe even more than that may have passed. So early development of the brain has happened by then. So it's important to plan a pregnancy. Maybe taking folic acid, taking enough nutrition, and may not the mother to become should not have uncontrolled maybe physical illnesses and even mental illnesses. All these things can affect the growth of the fetus, growth of the brain of the fetus. Then substance abuse. It could be of the mother or later after the birth of the child. If the child starts to use substances in teenage years, it can adversely affect the development of the brain. And I mentioned about the stimulation and experiences which should happen appropriately in that age. Then only the expected maturity will happen, because when we learn something, when we train something, when we discipline a child, it means the preferred neural connections are being established so that the child will be molded into a disciplined, happy, and then of course academically also the child will perform. Then head injuries. Again, something which is overlooked in Sri Lanka. We see very often children being children going on bikes without helmets while the parents are wearing helmets, and also when they travel in motor cars, they are not being they don't wear seat belts, or sometimes they just stand behind the driver's seat and then just go talking to the parent. Then they might be even running around in the car, and maybe in a train or a bus. which is very dangerous. Head injuries in early age of early development can affect the brain development adversely. Then the brain development, it doesn't happen, not that all the areas start to mature simultaneously. It happens according to a certain order. First to develop is what you can see here, our memory and reward pathways, which is in the center, very center of the brain. And then, of course, other perceptual areas also develop concurrently. Other parts, which are what we call as higher functions, which is mainly due to our prefrontal cortices, the most anterior part, the part maybe in behind our forehead. That part is the last part to mature. So it happens around late teens, early 20s. And we often have struggle with adolescents, whether they are children or our own children, or maybe in a school, or maybe even in the university. And university students, most of their brains are also not fully matured. So what happens is now all the parts of the brain are matured by this time, and the judgment, the planning, the decision making, all these areas, all these functions are mainly done and controlled by the most anterior part of our brain, the prefrontal cortices. This part is not developed. So that is why adolescents act without thinking of the consequences. As far as the adolescents are concerned, they want it now. I want this, I want that, I want to do this. So that is how the adolescents are like. So they don't think about the consequences. Sometimes we use this saying, the adolescent brain is like a vehicle without brakes. So the part which put brakes on a running vehicle, like the brain, if we think of the brain, it is the prefrontal cortex, but still not mature. So it's important that as adults, that we realize that, also have a good relationship between the with the children from the very beginning. So it's easy to communicate with them during adolescence. If a parent starts suddenly to be very aware of the adolescent, then the adolescent might think මෙච්චර කාලයක් මාව මේ ගණන් ගන්න නැතුව ඉඳලා මොකද මේ හදිසියෙ මට නීති දාන්න පටන් ගත්තේ. That is exactly how adolescents have come and tell us. So what does a child need? Why does a child need a variety of experiences and discipline? As I mentioned, the development of the brain is strictly guided by the experiences. Just because someone grows in age, it doesn't mean that he gets these experiences. Think about a child who has been pressured to study. Okay, you have to study this subject, that subject, and then you have to pass O levels and then A levels and then enter university. But during this period, the child may not have been encouraged to engage in other activities, maybe maybe household work, maybe driving or something, which are essential skills to develop function independently. I'll give this example quickly. Back then there was this program before the medical, before the students entered the university, leadership program. I went to one of the programs, and I was, until the students got ready, I was having a chat with the officers in the Navy camp. And I asked, how are the students? And then he said, Madam, පිළිගන්න එකක් නැහැ. මෙතන ඉන්න දෙන්නෙක් කෝස් එක දාලා මෙතන ඉන්න බෑ කියලා ගියා මොකද ඇඳුමක් හොද ගන්න දන්නේ සබන් ටිකක් දාලා. So we are talking about adults, 19 or 20-year-old adults, still they can't wash their own clothes. So that is what I'm talking about. A child should involve in variety of activities like music, sports, art, etc. while studying. It will expand their scope. It is also essential that the child is loved, cared, and disciplined. A child should be allowed to take decisions and hold responsibilities according to his age. Now, age-appropriate responsibilities have to be given to a child when they grow up, and if they make mistakes, then he learns, and we, as adults, we can correct them. Then only he becomes confident about himself when they grow up. All these help in molding the brain so that the child becomes a responsible and happy adult. Obviously, our brain is the organ which makes us human. Our scientific name, Homo sapiens sapiens, is a Latin word which means wise man. As I mentioned earlier, the mind originates from our brain. Mind includes aspects of our brain, our intellect and consciousness, which manifest as thoughts, perception, memory, emotions, will, imagination. So it is very important that we take care of our brain, so the mind. Parenting. I'll start because this is a lifetime approach. I thought of starting from parenting. Parenting, the most complicated job in the world, but no one look for qualifications to be a parent. I'm not saying we have to look for qualifications, but this gives you an idea what a responsible job to raise a child is. Parenting describes the process of promoting and supporting the physical, emotional, and social and intellectual development of a child from infancy to adulthood. So it's the parents who should mold this very immature child, the infant, into a mature, responsible, disciplined adult. Important aspects in parenting. It's consistency. Consistency is considered the backbone of child rearing. Both parents should be in agreement with what ground rules that the child should have, and also other adults who live in the same household should also adhere to this. Sometimes we have seen when children are raised in extended families, even though the parents have laid down certain ground rules, sometimes the grandparents don't adhere to that. So then it is not going to work. Consistency is very, very important. Then there has to be consequences to the behavior. I'll come to that. I have a diagram to show. Communication and spending time with them. It is very important, again, from the very beginning, because if the person has if the child has a good communicating relationship with the parent, then whenever they have a problem, even in their adolescence, they would come and talk to the parents. Rather than going to their peers when they have a problem. But in contrast, if the communication and relationship is not good, then they will tend to go to their peers for advice who are equally not informed well. So that can create problems. So it's difficult to try to establish a relationship with the kids when they become adolescents. It has to be from the very beginning. Teaching skills and coping strategies support the children to recognize their own strengths and weaknesses. Be aware of the child's whereabouts and friends. Again, parents have to be very tactful when inquiring about these things. Enhance play and leisure time. parents and other guardians have to be role models. Conduct of parents, attitudes, beliefs, how the parents treat each other, how they communicate with each other, with children. So parents, for that matter, all adults who are in close contact with children, they have to be role models. Children learn, observe them and learn their behaviors, whether they are good or bad. And if we think about ourselves, we can relate to this. We look into maybe our teachers, maybe our parents to acquire certain behaviors. And if again I am to take an example, on the road, maybe a person wants to buy some fruits from the fruit stall, and the children are also seated in the back. Then the driver may just stop just in front of the fruit stall without even getting down from the car, blocking the whole road. They might buy fruit. And children, they don't see it as something bad because it's their father or the mother who is doing this. So they will continue to do these things. This is how we always say the next generation, the new generation is not behaving well. They are like this, they are like that. The parents are responsible for that. These behaviors are taken to the next generation. So we have to be very careful when we do these things in front of our children, our young ones. Now, this is not only applicable for children, it is applicable for anyone. In psychology, we say all the behaviors have a consequence. If the consequence result of the behavior, if the consequence is a positive one, if it is liked by the child, then obviously the child will engage in the same behavior to get that positive result the next time. And if the consequence was negative, then he will not engage in the same behavior because now the consequence had been low, consequence has been negative. So it's important in child rearing that children should understand that there will be bad consequences for their bad behaviors. What is stress? It is the response of the body to any type of demand or threat. We all know it, and it's a natural physiological response. And it is a life-saving situation. If we talk about COVID infection these days, if one of us get COVID infection, then there has to be a proper stress response for us to recover. In evolutionary perspective, essentially the response prepares the body to either fight or flee the threat. So obviously, either to fight or flee, there has to be a lot of energy. The muscles have to have a lot of oxygen and then sugar, glucose. So then only muscles will have enough energy to start either fight or they run. It's a natural response, but once this threat passes, the other systems in the body will bring our body back to basal line. The problem of stress is if it is quite intense, that the person is not able to do the task at hand, or stress goes on forever. So what we call as chronic stress. Then you can imagine there will be continuously increased blood sugar. There could be continuously increased heart rate, blood pressure. Then it becomes a problem, and in the long term, they might even have increased high blood pressure and also blood sugar, diabetes or hypertension. And these days, most challenges are psychological in origin. Body doesn't know how to differentiate between physical stress factor, so psychological. So it mounts a full-blown stress response, and that is what has happened these days. Challenges in day-to-day life. So you can see needs, demands of the child, demands at workplace, relationship, if there are relationship issues between the couple or with the family members, financial needs, mental illnesses, mental health problems, all these things contribute to stress. How do we know that we are stressed? There are psychological as well as physical signs and symptoms. Psychological symptoms are they feel sad, සතුටක් නැහැ, දුකයි, anxious, හැම වෙලෙම කලබලකාරී ගතිය, relax කරන්න බෑ. Then irritable, තරහ යනවා, poor concentration, people can't concentrate on anything. මොලේ හැමතැනම දුවනවා, හිත හැමතැනම දුවනවා. Expecting the best, නරක දෙයමයි හිතෙන්නේ, ඕක හරියන්නේ. So physical signs and symptoms. They experience increased heartbeat, then sometimes difficulty in breathing, and then tremors, then increased sweating, muscle aches and pains, and headaches, especially tension headache. Tension headache is the typical tension headache is where one feels there is a band-like pain around the head. Why do individuals vary in their responses to challenges? And if you think about you and maybe others, you know everyone doesn't get stressed up with the same thing. We are different in the way we feel different types of stresses. If we think of a life event or a challenge, then this life event or a challenge kind of process through us. If it's me, it will go through me and see, depending on my beliefs and expectations, past experiences, life skills, my self-esteem, resources available, and my skills, I may be able to cope with this even without realizing that this is a stress. So whether the life event is perceived as a stressor by the individual or not, largely depends on these characteristics of the individual. And okay, recently I saw so many young men and women after a relationship breakup. So it's a life event, a challenge. Now that after having a relationship for so many years, it has now breakup. So now it's relationship breakup can be very challenging and very sad, of course. It will take some time to recover. But if someone, okay, one person after relationship breakup would, if he thinks so, his belief system is, then යාළු වෙලා හිටියා නම් එයාව පඳින්න ඕන. එහෙම තමයි අම්මා තාත්තා කියලා තියෙන්නේ. If that is the belief system or attitude, now you can think this can be an additional stress to that person. If someone, if a second person thinks, okay, now, yeah, I feel sad, but it's okay. It didn't, it ended because it didn't work. So in a way that's better. So I can go for, after some time, if I find a better partner, then I can have another start the new relationship. So all these things I have listed here, they are part and parcel of parenting, and then maybe things they acquire from their peers, society, and then maybe teachers. So it largely depends whether someone feels something as a stressor or not on these things. What do we need to live a life with less stress? Sleep. Sleep is very, very essential, and it is a highly preserved function in evolution among animals. And we know when during evolution, if something is not vital or essential for life, over many millennia, it will go off. But sleep is not something like that. It is still a well-preserved function. During sleep, there is restoration of many systems in the body, like nervous system, immune system, and endocrine system. And you can see it's not that when we fall asleep, it's not that we can't say it's the brain stops function or something. The brain is resting. Yes, some parts are resting while other parts are more active than the during the daytime. So it's very important that people have a proper continuous sleep. Not that sometimes I know students, when they study, they sleep for 2 hours and then keep awake for another 3 hours, then sleep for another 2 hours. It is not healthy at all. The sleep has to be a continuous sleep, because all these cycles I have shown in this graph has to take place. If it is only short periods of sleep, these cycles don't happen properly, and then the function of the sleep will not happen properly. And these are some effects of sleep deprivation, and you can see risk of diabetes can go up, then impaired immune system, which is the system which protects us from all sorts of infections, then cancers and all. Second one is new ways to think. I'll take the same example after a relationship breakup. So that's something external to us. So one might think, අයියෝ මගේ life එකම ඉවරයි දැන් මම මොකද කරන්නේ? Then the physical symptoms will appear. She or he may not be able to sleep, maybe having poor appetite, various aches and pains. Then behavior, if the partner was another university student, she or he might not now go to the classes, thinking that others will laugh at me, or maybe if I meet that one, the ex-boyfriend or girlfriend, what would I do? Feelings obviously quite sad. Now, these are the main like components of our mind. You can see all are interrelated, very tightly associated. We cannot take one in isolation, other three will follow. So if we are aware of this and try to make even one component positive, it can behave starting at some point. Then others three will become positive, and the other and vice versa. So okay, if we feel very down these days, it's natural to feel it's natural to feel down, we'll say. And then you go for a walk, which is a positive behavior, or maybe listen to some songs that you like, a positive behavior. Then these negative thoughts, the loneliness, that will go away. Maybe at least the intensity will go down. So if we are mindful of this and then try to change our behaviors, our thoughts in a more positive manner, then it will also help in reducing stress. Regular physical activities, at least 30 minutes a day, 5 days a week. And during exercises, there is this hormone called endorphin, which is released into the bloodstream. When endorphins act on our brain, it makes us feel happy and also relaxed. So in addition to the benefits we get, physical benefits we get out of physical activities, there are a lot of mental health benefits as well. A time for ourselves, our personal time, my time, මගේ වෙලාව, මට විනාඩි 5-10ක් දවසකට. Maybe to read something you like, listening to music, painting, whatever you want. Time with the family and friends. and then another maybe at least 5 to 10 minutes, 15 minutes with our loved one. Very important to limit screen time. We have our phones, and sometimes some people have got really addicted sometimes to phone. They keep on going from one to the other, maybe WhatsApp or maybe Facebook, whatever. So a lot of screen time. Screen time is can impair one's sleep, and also it reduce one's concentration as well. Restrict after our work. That is also something that we have to think. Taking regular breaks out of work after doing work for some time, and it's very refreshing to have a break and then go back to work, and the efficiency of work will also go up. Let children be as independent as possible. Let them do something for themselves. Just because a child is doing an exam or studying, don't give them everything. තේකත් ළඟට හදලා දෙනවා, කෑම එකක් ගිහිල්ලා තියෙනවා. No, that is not how it should be. It's a break for the children, and also they will learn how to make a cup of tea or prepare a meal. Not the whole meal I'm talking about, but something small. And I know there are especially mothers, they stay till around 12, 12:30 until their child finishes studying for the day, to make him a cup of tea. And then the mother has to wake up next morning, early morning, to prepare breakfast and all. So unnecessary trouble, unnecessary stresses. Taking a balanced diet, that is also very important. Measuring obesity in South Asians, you can see these cutoffs are not the same as for the Westerners. Their cutoffs are quite high. So these are for South Asians. Then couple relationship. Then having not so healthy relationship with the partner is going to make us feel a lot of stress in one hand, and on the other hand, if someone is having a good relationship with the partner, it kinds of acts like a stress absorber as well, because then they talk to each other and then they share things between them. So the partners can ventilate their issues so that it itself will give some relief to the stressed up partner. So a couple relationship can be affected by so many factors I have listed in here. So I'm not going to go into detail. Yeah, sexual relationship. This is again part and parcel of a couple relationship. Now, when I mention couple, it could be a heterosexual couple or a homosexual couple. The principles apply for both. Now, about sexual relationship, according to the Oxford textbook of psychiatry, human sexuality is more about fertilizing relationship than sex. So one can understand how important sexual relationship is for the healthy relationship between the couple. The quality of sex life greatly affects general well-being of the partners. When considering healthy sexual life, privacy is very important, and then the focus on sex. One can't enjoy sex while thinking of something else. කරන්න තියෙන වැඩ, or ළමයින්ගේ මොනවද වැඩ, things like that. Or it may be that thinking of a different partner also, but still focus on sex is very important when to enjoy sex. And people who are in long-term relationships, they might find it quite boring. They might find sex boring, and it is with the consent of both partners. It may be useful to explore each other's preferences, new ways to explore pleasure. It will add some spice to one's sex life so that their relationship as a whole. Impact of mental illnesses on one's sex life is again very important. Now, people tend to think about sexual organs, main sexual organs, when one thinks about sex. Men and men, like external genitalia of men and women. But when it comes to humans, the brain plays a very, very important role in sex. If someone has a mental illness, I'll talk about the depression later. When a person has depression, then the person sees everything negatively, and he or she is unable to experience pleasure. So depressed brain is not able to experience pleasure, or that person may not even like to engage in sex. Really, and during orgasm, there is this hormone called oxytocin, which is released in profuse amounts. And in like general terms, they call this the love hormone. When the oxytocin is released, it improves the bond between the couple. So it gives ecstatic pleasure, and also it improves the bond between the couple. So, and orgasm is a nature's way of giving ecstatic pleasure. And it has been shown over and over again, couples who have good sex life, they have less risk of having cardiovascular illnesses like heart problems, strokes and all. And also their relationship is quite good, because why the cardiac functions improve is during the orgasm. It's mainly the systems which relaxes our body is the one which are active during that period. That is why it reduces the risk of cardiovascular disease. Sexual identity and sexual orientation. I mentioned earlier, our brain is the main organ which determines our sexuality, one's sexuality. So there are two terms which are very important when we talk about sex. So gender identity is one. Gender identity refers to one's own perception of being a male or a female, despite his biologically determined sex. So if someone has X and Y chromosomes, the sex chromosome, I mean, biologically, then it's a he, it's a man. And if someone has XX, then it's a she, a female. Even if they have the biological sex, we'll take a man as an example. Physically, he is a man, but he might feel that he is not in the correct body, that he should have born as a female. This is a very extremely distressing situation. And the person has nothing to do with it. It is the way the brain is wired. So now there are a lot of help for this type of people, so they can go to the psychiatrist and get help how to overcome this distress. And sexual orientation describes one's preference of sexual attraction. One might get attracted to the same-sex partner, or maybe to an opposite-sex partner, or sometimes one can get attracted to both sexes. So these are all normal, and a person, if she or he feels I'm abnormal or something, then it's not abnormal. The other thing is other people. They should not look at them with discrimination. There shouldn't be any stigma attached to people who are homosexuals or maybe bisexual. They are all natural. They are all natural sexual practices. Now, I usually say this to emphasize this fact. It's again how that particular person's brain is wired. If someone asks a heterosexual person to think about a same-sex partner same-sex person in a sexual way, he or she is unable to do that. It's the same for the homosexual person. And sometimes people say, if you think about it, then you can change it. No, he or she can't change it because it's the way the brain is wired. And sometimes the homosexual people with homosexual orientation, they can be forced to marry. It doesn't. It is not going to work. Even the marriage is not going to work. The lives of two people are going to be in trouble. So that should not happen. Again, thoughts of sex originating in the brain, taste, smell, touch, skin, hearing, ears. So all these are very important. Then people have diverse desires when it comes to sex. So these are the reasons why it happens. The other important thing is when we talk about reducing stress is avoiding alcohol and other substances of abuse. People have a lot of myths about alcohol. To take quarter bottle of arak once in a month is okay, and then because I don't drink daily, or taking a glass of wine at the end of the day relaxes me. All these things people talk about day to day. All alcoholic beverages, obviously, you know this, contain ethanol. How it affects the body depends on person to person. Whether one is a male or a female, one's genetic makeup, what other illnesses one has, and the medications one is taking, the amount of ethanol one takes, the occasion on which one takes alcohol. So it is generally known South Asians have a lot of adverse effects when they take alcohol compared to Westerners. How does alcohol affect our brain? Now we know when we do something we like, when we get something we like, we feel pleasure, we experience happiness. Again, we know the responsible organ is the brain. There is this specific area in the brain called as reward system. When we do something we like, then there is dopamine, which is a neurotransmitter released in reward system, which we experience as pleasure. Alcohol and other substances of abuse kind of hijack this reward system. What it does is it directly releases dopamine from the reward system, and it is experienced as pleasure. So people, if they are not aware of these things, they continue to take alcohol or other things to experience more pleasure, and without even knowing, sometimes they can get addicted. So some activities which gives us pleasure are having sex, eating a tasty food, being with loved ones, going on a holiday, and achievements. There is this concept introduced by WHO called low-risk drinking. Earlier there was a concept called safe drinking. Now there is nothing called safe drinking, it is low-risk drinking. First, we'll see how to measure the amount of alcohol in an alcoholic beverage. You all have seen this, I think, in alcoholic beverages. the above type of liquor has 40 ml of pure ethanol in 100 ml. So 10 ml of pure ethanol equals to 1 standard unit of alcohol. And if a person takes 100 ml of this particular type of liquor, he takes 4 standard units of alcohol. But the recommendation for low risk drinking is 2 units a day for males and 1 unit for female. So now one of the common alcohol beverage used in Sri Lanka is like types of arak. Its concentration is about 33. Now, if I go back to this, take a quarter bottle of arak once a month. Usually a bottle of arak contains about 26, 27 units of alcohol. So 1 quarter is about 7 to 8. So that's way about the recommended amount for low risk drinking. So even if someone takes it once in a year, that is above the excess. So that's binge drinking. And a lot of Sri Lankans are binge drinking. They go to parties, they go to funeral houses. Most of them binge drink. And Sri Lanka, according to WHO statistics, we have a lot of binge drinkers. And even if someone is hoping to drive or maybe try to operate machinery or is ill or pregnant or below the age of 21, then that person should not take alcohol even in that low risk drinking limit, because alcohol is a cerebral depressant. It slows our brain. So if someone is driving and then there is a slowing of reaction time, you know what can happen. The person is prone to accidents. Getting proper treatment for mental illnesses and physical illnesses is again very important, because having these illnesses increase our stresses. Useful links on how to do deep breathing exercises to reduce stress. These are some links you can. I'm going to give the slides to Dr. Arya Sena, so you can go through these. Then a word about healthy aging. Again, now the whole idea of us doing all these things is to live happily throughout our life. Then it's very important that throughout our life we have adequate sleep, stay stress. I'm not saying we can live stress free, but it is about how we cope with stress. Then regular physical activities, healthy diet, coping skills, avoid substances of abuse, engage in variety of activities. Social engagement is very important. And when we involve in physical activities and doing a lot of social activities, and also keep our brain active by doing maybe learning new things when we reach old age, it's very important so that our brain is active and the chances of our cognitive deterioration, our memory impairment could be less. And maybe we can postpone the onset of these things by 1 or 2 years. So that has been shown. People who are active throughout, then the chances of that person developing cognitive problems, memory problems are less. About mental illnesses, who can get it? Anyone with a brain. So we all have a brain. Any one of us can get a mental illness. They can be treated with medications and psychological treatments or both. These are symptoms of depression, depressed mood. Dukai. It's not about being sad once in a while. It happened to all of us. It's about pervasive sadness. Dukai. Satutak ne, loss of interest and enjoyment. කිසි දෙයක් ගැන ආසාවක් නැහැ, කැමැත්තක් නැහැ. Reduced energy leading to increased fatigability and diminished activity. මුකුත් කරන්න පණක් නැහැ. පටන් ගත්තත් හරි හිමින්. ඇයි ඇඟට මහන්සි. හයියක් හත්තියක් නැහැ. Reduced concentration and attention, reduced self-esteem. මට ඔව කරන්න බෑ. ඉස්සර වගේ නෙමෙයි. මට කිසිම විශ්වාසයක් නැහැ මා ගැන. Ideas of guilt and unworthiness. මං කිසි වැඩකට නැති මිනිස්සෙක්. මන් නිසා තමයි මේ දේවල් ඔක්කොම වෙන්නේ. Bleak and pessimistic views of the future. මට අනාගතයක් නැහැ. මට විභාග පාස් වෙන්න බෑ. මට කිසි දෙයක් කරගන්න බෑ ඉස්සරහට. Ideas or acts of self-harm or suicide, disturbed sleep, diminished appetite. And about suicide. Now, people have this myth. If someone expresses suicidal ideas, then that person is not going to harm himself, because the common myth is if someone wants to commit suicide, then why should he come and tell us? He can go and do it in secrecy. But no, anyone who feels like committing suicide, please go and see a doctor. If you know anyone who says that they are they feel they have suicidal thoughts and expressing wishes like being dead or life is not worth living, then take it seriously, listen to that person, and then direct him or her to a nearby psychiatry unit. Symptoms of anxiety, fearful anticipation, හැමදේම නරකක්ම වෙයි කියලා හිතනවා. Irritability, sensitivity to noise, පොඩ්ඩක් නැත්තම් ගැස්සෙනවා. Restlessness, පොඩ්ඩක්වත් rest කරන්න බෑ, හැම වෙලේම we say always we feel edgy. So poor concentration, worrying thoughts, dry mouth, හැම වෙලේම උගුර කට වෙලා. And there are people who would even keep a bottle of water and drink. උගුර වේලන. Difficulty in swallowing, හුස්ම උගුර හිර වෙලා වගේ, පිට උගුර යනවා. Abdominal discomfort, හැම වෙලේම බඩ දනවා වගේ. Frequent or loose motions. Sometimes හැම වෙලේ කොහේ හරි යන්න ගියත්, presentation එකක් කරන්න ගියත් toilet යන්න ඕනේ හැම වෙලේම. Constriction in the chest, difficulty in breathing, හුස්ම ගන්න අමාරුව. If we do not keep our stress levels low, there will be poor quality of work, there will be burnout, the beast living inside us may unleash. And now I told, without our prefrontal cortex, we can't keep ourselves under control. Now we know animals, when they want to do something, they will do it without thinking of the consequences. They do it now and they will get it now. So they can't postpone or wait for the right moment or something, or they don't think about, they are not, they don't think about the consequences, and also they don't think about what others think or something. So in our case, we keep guard on our actions and also our thoughts. Okay, these things are good things to do, the other things are not so good thing to do. But when we are stressed up, this inhibition, the inhibition we put on ourselves may go down, and then we might start to shout at others. Sometimes some people become so out of character. Then we are prone to errors, stress-related illnesses, impact on the family is enormous. Then there will be poor quality of life because we are always under stress. And yeah, this is my last slide actually. Yeah, most of these problems, I'm talking mainly about stress, come from the fact that we have forgot about the animal living inside us. We have become so kind of civilized, and then we are not in contact with the natural world anymore. So we think ourselves as completely different people. We can do anything. We are like, no one can harm us. Things like that, maybe. So, but of course, we have a living being, an animal inside us, which needs rest, proper sleep, and then some time for ourselves and to be with us. So if we think about that animal living inside us for few minutes a day, then we can like get ourselves back from this constant running behind this goal and that goal and so on. Of course, we have to achieve our goals, but then again we have to keep healthy as well. Yeah, okay, thank you very much. I'm happy to take some questions. Yeah, it's 4 minutes past 4.
Thank you, Dr. Devasnika, for the very interesting talk. And then this is your chance. If you have any questions or concerns, now is the time to ask from Dr. Devasnika.
You can even send through chat.
Dr. Devasmika, I have a general question to start with.
Yeah.
In our society, our society, how often do we tend to go for treatments for this hospital if we get some issues like stress, anxiety, depression? Is it often happening, or should we educate ourselves more about this to get the treatments?
Actually, there are so many people who need help. I'm not saying it's always a tablet. There are a lot of people who have problems. If they come to us or the mental health services, then there are a lot of things that they can achieve. And when it comes to mental illnesses, I wanted to explain, but I didn't have time. When it comes to mental illnesses, because of stigma and maybe the way they are brought up and all, they always tend to attribute these mental illnesses or worries and all to some other unseen forces, maybe planetary effects, so maybe Naraka Vela or something. And they go behind various healers and then get into more trouble. Sometimes these people get abused, and sometimes they spend a fortune on doing what they are asked to do, and then end up with nothing. So it's the stigma and unawareness of the illnesses, and as I mentioned, the way sometimes they are brought up. Now, if parents are are believers of all these unforeseen things, and if children also observe that okay, if something goes wrong, if you feel something is not right, then first thing to do is to go and see a healer to read your palm or maybe read your horoscope or whatever. And if when two people get married, they go to look matching of horoscopes, and we have seen hundreds of couples who have very good match in horoscopes, but end up separating after 2-3 months of marriage. So people have to believe in themselves, and that doesn't come right away. That also has to come from the very beginning. So parents are very responsible, should be very responsible. Nowadays also we see all these things happening before an exam. They go and do some barahari or something, and then children also think, okay, amika karane mata දැන් හරියන්න ඕන. So they tend to believe in things, and these type of myths, beliefs which don't help them go in generations, and they add to day-to-day stresses. there are lots and lots of people who are out there who need help, who need treatment, but they don't come to us.
Thank you, Dr. Devasmika.
Okay, welcome.
Dr. Devasmika, I have this question. Now, being in the Faculty of Medicine, what are the most common type of problems that you see among university students, and what advices can you give them?
Common problems means as far as academic things are concerned, or
Yeah, maybe concerned about the university life, maybe just into a new life. What kind of situations that you have come across?
it's about now, as I mentioned during the talk also, most of the students, this is the first time they live away from home. I think most have been brought up at home. So if they don't have skills to look after themselves, like prepare a meal or maybe find the meals and to attend to their self needs, then it can cause problems, and we have seen that happening. And also sometimes preconceived ideas about lecturers, so maybe senior people, and maybe certain people, they think, okay, seniors are bad, or maybe we have to behave the way the seniors ask us to behave. And no, maybe we shouldn't ask questions from the lecturers, they will reprimand us. All sorts of preconceived ideas are there. So now all the students, they are 18 plus, they are students, they are adults. So they have to behave like one as well. So if now there is, I know there is ragging going on maybe in some faculties, but if a senior person says or asks to do something which you don't like to do, then as an adult you should have the courage to say no, because one aspect of being an adult is that we are responsible for what we do, what we say, what the way we act and all. So if someone asks us to do something that we don't like to do, even if that is the case, if we do it, then it's the responsibility of us that we have done that, not like a child. So we have to say no to these things, and then should work with staff to sort their problems. I think staff are there to help them at any time. So that is one thing, and there could be problems with the language, English language. Most courses are done in English, and if we think it that way, students have entered the university after a very competitive exam. So if they can enter the university with high marks, then they can think by themselves, why can't I improve my English? I can work on that. And if they think අනේ මට බෑ මම අපේ ස්කෝලෙන් ඉංග්‍රීසි තිබ්බේ නෑ මම ගමෙන් ආවේ, so those are the ideas that people have usually. Now most people have a phone, and when it was our days, we had to carry a what do you call the dictionary. Now you can have a dictionary in your phone. Whenever you hear a word, you can look it up, the pronunciation is also there, and then have some maybe 10-15 minutes allocated to improve your English. So it can be done if you really think about the way to do it, rather than thinking how to do it, how to do that. And I'm sure staff members are also there to help with everyone. So those are the main issues, I think. And of course, financial problems are also there. In our case, there are a lot of scholarships available. So students are students can get financial support. I think it's the case with most faculties, no?
Dr. Devasmika,
Yeah.
what I think is in our faculty, the main issue now is not that actually. The thing is that unlike in the medical faculty, science faculty, the students are at home. So almost all the students are at home, and then sometimes some students call us, and then when we discuss with them, we realize that because they are staying at home, and then their future is kind of uncertain. So first I thought that most of the 300 third year or fourth year students are just under stress, but recently I got to know that the first year students are the most stressed out students. So the thing may be they have not even entered to the universities. Their orientation was also held online, and they have not even seen the university and not have been there, and then they don't have any social interactions. So those are the main issues with our students. So they don't actually, that if they are here in the faculty, that they get the chance to talk with us. So now they don't have that kind of facilities, and they have to stay at home. Even if they are university students, they are still at home, and then they don't know what would be their future, and then they are just we are just having the lectures and then doing everything online. So I just feel that because of that, most of the students are just stressed out. So then if you can, as just expert in the area, if you can just advise them how to cope up with that, that would be great, I think.
Yeah, that's why I have these two questions after finishing my lecture, because I thought rather than concentrating on this, better to highlight the general issues and then talk about the current issue, mainly this pandemic. And this was an unprecedented event. We never knew that this type of thing would come, and that it would last this long also. So I would like to hear from the students, now, from what I have told already, what are the things that you can change to reduce stress, the challenges, how to face challenges during this time in a more positive way. First tell me what the challenges are, as Professor Udugala mentioned. Staying at home. Obviously, there are frequent lockdowns. Even if there are no lockdowns, our movements are restricted and we can't meet people. What can we do about it? Like, one thing would be to, now there are a lot of access to online access. There are online access. So what you can do is maybe have frequent, you can have your own groups and then have frequent chats, and it could be restricted by your data allowance and all, but try it. That is one thing you can try. And the other thing is the meeting may not be advisable at this point in time, but now that everyone is being vaccinated, if there is no new strain, hopefully we can have some free time in the future. So we can hope for that. But other than that, how can you reduce your stress during this time? One main thing, one major reason why people are stressed during this time is that they don't have a structure to their day. Now, earlier we know, okay, weekdays we know we have this, wake up and then go to the faculty, go for lectures and then come home, you do this and that. So there was a structure. Now, over the past 1.5 years, this is gone. It is important that we structure our day. Maybe you can have a timetable like in school days. okay, Monday morning, this is what I do. And it's important to get ready, maybe have a different dress as if you are going to the faculty once in a while, rather than staying in the same clothes or maybe in the same night dress the whole day. So it doesn't give you any sense of change to a day. So can change clothes and then have work, arrange yourself into a particular structure and have time to for yourself, do some maybe reading and anything you like, painting or whatever, and then some time to do either jogging or brisk walking or something. We can't go out, yes, I agree, but most of us have some space around, maybe walk around your house or maybe within your house for half an hour. So see the difference, and I'll assure you it gives you a great pleasure, and also you will feel the relaxation. So that structure should be there, and just because you don't have to wake up the next day early morning to go to the faculty, don't go to sleep late. Sometimes people watch TV or maybe look at the phone until very late. The screen time, increased screen time reduces the quality of our sleep, which will again impact our next day, our mood, our functions, our cognitive, our thought process and all. Even without being aware, they can get affected. So have regular sleep bedtime. Go to sleep around 11 or maybe 11 p.m. These are examples, not the exact time that you should be doing this. Go to go to sleep around at a particular time, and then maybe wake up around again at a particular time. So your day is structured, you have a regular sleep. This will help you to feel less stressed. And the links I gave you, they give like some instructions on how to do deep breathing exercises, which is about 10 or 15 minute thing. If you do it properly, again, that will help you to relax a lot. So do the breathing exercises regularly, and physical activities and the structure of the day. Have contact with your mates regularly the way you can, either phone calls or online media, using online media. So think about, do those things. Those are the things that we can do. Don't think about the things that we can't do. Like don't think about what you would do about the future, what the future holds for us. Those things we can't think about at this point. I'm not saying this is going to go forever, but we are not able to give a time frame. This has affected the whole world, not only an individual. So take one at a time and don't think about the whole future as a whole. So very short periods at a time, and then go from there.
There's a question on the chat box.
Yeah, okay. The first question is it okay to take sertraline? Yes, it's a safe medication. You can continue it until your psychiatrist says you can stop it now. Few days ago, I had same symptoms as you mentioned due to stress out or something. I have had lots of assignments and had to prepare speech also on that day night, and I was so stressed. Same day I have been vaccinated, second dose of Moderna. So shaky fever, sweaty symptoms to appear on that night. Now, it's mild fever can be a symptom of the taking Moderna, any vaccine. So fever could be due to that, but other symptoms you have mentioned here could be due to stress. And I don't know whether you were able to prepare your speech beforehand, or you just started to prepare it on the same day. Try to prepare for things early. That's the best thing to reduce stress. And before doing any speech, it's natural to experience some stress, some tension, some racing heartbeat, or maybe difficulty in breathing, dry mouth. It's quite natural. If you are used to do those breathing exercises, they are very helpful in this type of occasions also. What you can do is, if you are used to do it, you can take a few breaths, like few deep breaths like that, and then you will feel quite calm, and then you can go along with what you have to do.
Dr. Devasmita, there's a question in the chat box also from the audience. It says, it's difficult to focus, don't feel like concentrating on the lectures, although we sit in front of the laptop. So it's a difficulty in focusing, I think, mainly the question.
Yeah, that actually lots of students complain these days. If you have been looking at the screen for quite some time, that can happen. But if if it happens even after looking or listening to the lecture for about 20-30 minutes, then it could be due to or the fact that you are quite stressed up, or maybe you have depression or some anxiety disorder. Best thing is to, I think, come and meet us. Do we essentially have to take medical treatment for anxiety, or can we control it by ourselves by other methods? Can you explain? It depends on the degree of anxiety you have. Anxiety is a symptom. Like now, when someone experiences fever, it's a symptom of an illness. Fever can be due to a pneumonia, it can be due to a urine infection, it can be due to an infected wound. So likewise, anxiety is also a symptom. So we have to see why you are anxious, and then whether it needs medical treatment or some counseling like thing. Without having much information, I really can't comment. Yeah, I am also first name. There are lots of assignments. Now, assignments, I'm not sure about the curriculum. Are they being overloaded? And that is one complaint we usually hear from our medical students also. They have back-to-back lectures, so maybe, yeah, appointments, which make them quite stressed up, and the fact that they are not able to meet now and have a chat and then do their own things also have affected now. Earlier, even in the middle of all these things, they managed to meet each other and crack a joke, and those things they enjoy. But now it's only work, work, and work. So do they have any leisure type of things, maybe even online, and assignment wise, are they being overloaded? I don't know. Yeah, we would love to do practicals physically, love to meet friends and do exams physically. Yes, of course, that's I can understand, and even for us it's the same. Though we keep going to the hospital, we hardly meet people. At least we go out. I know I can understand your concerns, but what I what I would like to advise is don't think about the negative things always, and take something positive out of this. Now, earlier people, when they have maybe studies, so have to go for work, then whenever we advise them to do exercises or have some time to relax, then what they said was, okay, ane vela ne vada. Now, okay, as I mentioned earlier, have a structure to the day and have time for yourself, and then do some exercises. And once this pandemic situation is over, try to inculcate that into your lifestyle. Then it will go on until you become old, because life doesn't end after your university days. So to be happy and healthy, all these good habits have to be inculcated. So make this the time to think about these things and acquire, while going ahead with whatever we have at the moment. Tension, I get tension headache. What can I do about it? Actually, the exercises, the breathing exercises I told earlier on about, they are very good for tension headaches. So try do that. If it doesn't settle, please come and see us. I can't control my sleep even during daytime. I'm on treatment for depression. The sleepiness during daytime could be due to the medication. Some medications can cause sleepiness during daytime. The other thing may be that your depression is still not fully settled. Other causes could be things like thyroid problems, thyroid deficiencies. I'm not saying that is the case, but I think you can come and see me or one of the psychiatrists in, maybe you are at home, some psychiatrist in the closest hospital. Then he or she will talk to you and attend to the matter. Madam, stress can cause migraine, I think. Yeah, could you please explain? Yeah, migraine can be worsened by stress. If someone has migraine and if it is not controlled properly by medications, then that can also lead to stress. And migraine can be worsened by stress as well. So if you have migraine, best thing is to go and it is not under control, best thing is to go and see your doctor who is treating migraine. Could you explain some types of practices that we should follow daily to maintain our mental well-being healthy? I think those are the things that I talked about early, having a proper sleep, at least 6 hours, consecutive 6 hours sleep, and then taking a proper diet. And some people have the habit of not having breakfast. And maybe not having some other meal. No, it's important that one has proper meals, proper 3 meals, but not huge ones. And some people take one big meal and then skip the other one. That's not how it should be. It has to be equal size meals. And then that is number 2. Then number 3 is having regular exercises. And then number 4 is having good relationship with your parents, maybe your partner or maybe your friends. And if you have issues with them, it could be an actual issue that your friend doesn't like you or something, or maybe problems like that. But it may be you have some mental health issues, so mental illness, so that you see everything in a negative way, so that other people always get angry with you. So it can be either way. So and do these relaxation exercises I mentioned earlier, they will help you to stay free. And also, when you set targets, it's important to set targets within your capability. Don't try to do mama. There are people like that. Mama කොහොම හරි මෙච්චරක් ලකුණු ගන්න ඕනේ. එහෙම නැත්නම් batch top වෙන්න ඕන. So we can aim high, but if we try harder and harder, that we can't achieve, a target we are not able to achieve if we consider our capabilities. We have a set of abilities, skills and all, but with those skills we can go to a certain level, but beyond that we might not be able to. So if we think about achieving the highest level, then it can cause unnecessary stress to all of us. So what we have to ultimately achieve is something we like, and also something we can do. No, ultimately what you are targeting at the moment is to do a proper job. Proper in the sense, something you like, you enjoy, and which is a service to the others. Now, if I think about my job, this what I am doing, it's my job. It's just a job for me. So I earn because of my job, and it is the service to the other. Now, if I think about someone else's job, okay, maybe a person who grows food, vegetables, that person earns money through growing vegetable. So that's his job, but it's a service for me. So all the jobs are like that. If we think it like that, okay, but I have to be happy and I have to be passionate about what I do, then we don't have to think about the status or our Tanaten donor, and that this the thing about Tana and status in our society has placed great stress on us. What ultimately matters is whether you are happy about the person you are. And there are people who, if I take example from medical students, there are medical students who don't want to do medicine, but they are being forced by their parents to enter medical faculty because they think this is the like better job or the best job or something like that. And these students, they are quite talented in some other fields, but now when he or she becomes a doctor, he would not enjoy what he is doing and work, if we think about it, almost 1/3 of our life. So if we don't do our job passionately and if we don't like it, then you can think the stress it places on us. If we enjoy what we do, what we like, what we do, then it's very rewarding. It doesn't cause that much stress. How can one know the depression is fully settled? That is when you can function like you used to before the onset of depression. You may be able to sleep better and eat better, concentrate on your studies better, and you feel happy. You don't nag, you don't think about very trivial things. About all the negative. If you don't think about negative things forever, then you can think that you are recovered. You have recovered, but just because you have recovered, it doesn't mean you should stop taking treatment for depression. Because even after settling it you have to take treatment for depression for many more months. I sometimes feel frightened, like everything is going to fall behind and I might die now when this is not like real. Why is this? Sounds like you are experiencing what we call as a panic attack. Again, you have to go and see the doctor, the psychiatrist in the nearest hospital. Yeah, I think those are the questions here that I can see. Are there any more questions?
If there are any more questions, you can ask. Also, you can speak in Sinhala too.
Yeah, definitely, yes.
ඔයගොල්ලන් සිංහලෙන් ඕනනම් කතා කරන්න පුළුවන්.
I was not able to talk about many things now. Right.
Okay, we would like to know whether there are any more questions. ඔයගොල්ලන් සිංහලෙන් ඕනනම් ප්‍රශ්න අහන්න පුළුවන් මේ වෙලාවේ. Okay, in the absence of questions, shall we wind up then, Pramudda?
Yeah, one more thing I just wanted to, because I couldn't show everything. I would just show the book I have written. So if anyone is interested, they can have a look at it. Give me a second. Yeah, these are actually two books I have written. It is available in Sinhala and English, and there will be a Tamil version as well. And these are the contents of the book. First part is about mental health, and the second part is about mental illnesses. Sinhala English in දෙකෙන්ම තියෙනවා. If someone is interested, you can have it. And these are the contact details of the clinics we have in Peradeniya Hospital. And the contact number is this one. It's the hospital contact number. මේකට කතා කරලා සිත්සුව සායනය කියන එක ඇහුවනම් ටෙලිෆෝන් ඔපරේටර්ගෙන් එයා එතකොට එතෙන්ට ඩිරෙක්ට් කරයි. මේ clinics we have 5 consultants. ඒ consultants 5 දෙනාගේ clinics තියෙන වෙලාවල් සහ දවස් මේකේ තියෙනවා. කැමති කෙනෙකුට එන්න පුළුවන්. University students we usually take then and there.
Dr. Devasmika, I have a small question, especially for these students. I mean, some of them are living away from Kandy. So is there a opportunity for them to call these clinics and like explain their problem maybe and get some help over the phone?
At the moment, we don't have such a facility. What they can do is to, now that we don't know when the universities will be open, so what they can do is to go to the nearest hospital and they can meet the psychiatrist there, because just because even if the lockdown is there, we run clinics. And
Thank you.
yeah, police and yeah, anyone will allow them to go to a clinic if they say they want to see a doctor, even during lockdown period.
Okay, thank you, doctor.
Okay, okay, welcome.
Are there any further questions? Okay, in the absence of any questions, I would like to invite Pramudda to deliver the vote of thanks.
Good evening, everyone. First and foremost, I would like to convey my heartfelt gratitude to the guest speaker today, Dr. Devasmika Arya Singha, Head and Senior Lecturer, Department of Psychiatry, Faculty of Medicine, University of Peradeniya. Ma'am, thank you very much for your insightful words on the topic of keeping the mental well-being as a lifetime approach. It was truly inspirational. Also, I would like to extend my gratitude to Professor Manudevi Vayuganahenage, the patron of the Chemical Society and the head of the department, for the immense support and guidance given throughout these sessions. Next, I'm thankful to Dr. Thiloka Arisena, the senior treasurer of the Chemical Society, for always supporting and guiding us. Also, we are very honored to have the lecturers and the academic staff members from all the departments and faculties. Thank you very much for sparing an invaluable time despite of your busy schedule. Next, I would like to thank Mr. Nipun Chandrasiri for the technical support provided. Last but not least, I'm thankful to all the colleagues and the participants who have joined today. Thank you very much and stay safe.
Thank you, welcome.